My name is Dr. Sheila Morrison. I practice at Mission Eye Care Center for Dry Eye and Corneal Disease in Calgary, Alberta, Canada. I'm an optometrist and I have a special interest in medical contact lenses. I first became interested in specialty contact lenses because I noticed challenges in some patients fitting them with regular glasses or contact lenses. Folks that have had injuries or severe ocular surface disease sometimes cannot get the quality of vision that they need for daily activities using standard glasses and contacts. Specialty lenses opened a whole new world for both for myself and for my patients in that we could instantly change the way that they saw the world by placing devices on that could neutralize their vision better than what could be done with standard contacts or glasses. Jeff came to our practice because he had become frustrated with his vision secondary to surgery that he had about 10 years ago. He had PRK, was formerly a -2 myope, and a really good result other than, especially in dim lighting, he had always noticed since his surgery distortion of lights, kind of monocular ghosting, meaning that when he looked with one eye or the other, there was a little bit of a kind of a halo or a ghost on everything that he looked at. We initially tried fitting Jeff in soft lenses, including lenses with a thicker modulus. We tried putting him into a hard lens that had a standard optic. And really, Jeff still continued to have this complaint of 20 unhappy vision, where he was able to see the letters on the chart, but unhappy with his vision in the real world. Because this patient had been previously fit with other lens modalities, at the point where we were ready to investigate the utility of eccentricity and potentially HOA optics, Boston Sight was a good choice for us. And that's because we were initially able to use what's called a Boston Sight Smart 360. It is a lens that is designed off of ocular surface mapping, which speeds up the fitting process a little bit in the beginning for a patient. And so for Jeff, he'd already been through a couple different lens designs. I wanted to get him right up to the level that we needed as quickly as I could. So Boston Sight Smart 360 was great. From a standard Boston Sight Smart 360, which means that we again build the lens based on digital data of eye shape. We are easily at that point able to adjust eccentricity within that lens design. And once we had maxed out that capability, we were also able to horizontally shift right into HOA without any additional fitting steps. Just as simple as calling the lab to get the HOA lens in and then start taking those measurements with the OVIDs. As the doctor, there are a couple of ways that we can measure improvement because sometimes asking a patient to look at the visual acuity chart can be a little bit misleading. Patients will see 20/20 or 20/25, but still be unhappy. And really, they're the only ones that can view the world as they see it. If the only measurement is, can you see the A, B, C, or D on the Snellen chart? The first measurement was visual acuity with a standard lens, the patient standard hard lenses. Jeff was able to see 20/20 on the right eye and 20/25 on the left, still ghosty, a little bit unhappy. With his HOA corrective lenses, he was a solid 20/20 on the right and a 20/20 minus on the left. The other measurement for success is actually quantified with the OVID's aberrometer because the device will also take and give kind of an estimate of what the point spread function is or what the visual disturbance is or what the patient would see and create a simulation that you can actually show your patient, which is another really fun tool in working, with Boston Sight and OVIDs in this for Jeff is to be able to show him what did his aberration look like before the device was used with, a point function that had kind of a ghost coming or a hook coming off of it after the HOA is put into his lenses and remeasured with the same device. That ghost and the hook was a lot tighter and the point a lot easier to see as a single dot. Speaking for my experience and on behalf of my office, we love working with Boston Sight. Two prongs for me. One is the level of technology and innovation that Boston Sight has always been a leader in the field of specialty contact lenses and scleral lenses. And so by using a Boston Sight lens, I know that I'm getting the highest degree of technology. And I do have the ability to make customized modifications that allow me to fit patients at the highest level for safety and efficiency. On the other side, we just love the team. BostonSight has a wonderful customer service group, and we find it's very easy to work with the lab. They're very accommodating to set meetings and also to be able to have discussions specifically for different patient cases. So big thanks to BostonSight.